Hi everyone, Jennifer Blevins-Smith with Integral Clinic Solutions, and you're watching my YouTube channel, Navigating the Business of Medicine. Today we're going to talk about understanding MACRA and MIPS versus other payer incentive programs. We're going to break down MACRA, the MIPS scoring program, and how this differs from the incentive programs that commercial payers will have, like Blue Cross Blue Shield, Aetna, Cigna, etc. Understanding all of this matters because it impacts reimbursement, it impacts compliance, and it impacts performance, reputation, and public reporting, okay? So I have these notes because there's no way I was going to remember all the details. So let's go ahead and jump in. What is MACRA? I'm sure you've heard of it. If you're not participating in it, you've at least heard of it. So MACRA is an acronym and it stands for Medicare Access and CHIP Reauthorization Act of 2015. So it's been over 10 years that this has been into place. And the purpose is for the US health system to move away from fee-for-service to value-based care. I think it's moved a little bit slower than they anticipated. However, you can see that there are a lot more value-based programs out there for reimbursement versus fee-for-service, even though fee-for-service seems to still be dominating in most places. It replaced the old sustainable growth rate, the SGR formula that was previously adjusted for Medicare payments. And it created two pathways, okay? So you have the MIPS, which is another acronym, MIPS, stands for Merit-Based Incentive Payment System. And then the other track is the APMs, or the Advanced Alternative Payment Modules. And without going into a lot of detail, most providers fall into the MIPS program, okay? Unless you are a huge shared risk program, which you might be, and that's why you're watching this. But most practices, especially if you're a small private practice, you're most likely going to be in that MIPS, okay? So the MIPS scores providers each year on 4 categories, okay? So here are the 4. The quality of care, which is like your clinical measures and the patient outcomes related to them. Promoting interoperability, so using an EHR and a data exchange that is fulfilling the requirements that are set forth by HHS and CMS. Improvement activities, workflows that can improve care processes internally with your own practice. And then the cost. So Medicare Part A and Part B resource use tied to the claims. So cost is a huge piece of this, and I'm sure you know that already. And then each category contributes to a 0 to 100 MIPS composite score. Okay, so you get a total composite score from those different categories. And then your score, based on that, leads to a payment adjustment from CMS, okay? So if it's neutral, you don't lose any money, but you don't make any money either. If you have a positive score in their definitions, then you get money. You receive money. It's a bonus, essentially, right? But if you fall short and you don't hit your marks and you have a certain score, which they've laid out for you, I'm not getting into that, then you get a penalty, okay? The penalties, the bonuses, they're all applied 2 years later. So any of your 2025 performance measures and your reporting and everything will actually end up affecting your 2027 payments. So they're always like 2 years in the rears, if you will. So right now, if you've been participating in MACRA MIPS, then most likely you're seeing a bonus or a neutral or hopefully not a penalty from your 2023 measurements, okay? If that makes sense. And then it is all publicly reported. So your MIPS performance becomes part of the public provider profile. And that's how not only patients can compare physicians over other care, but that Medicare and other entities will use. Okay, so it's all public information. An APM, because we were talking mostly about MIPS, but the APMs is advanced. So it's like a shared savings, shared risk care model. That's why it's usually for larger entities. And one of the perfect examples of this is an ACO. So the Accountable Care Organization. So if you have any ACO contracts, that's what you're doing. And basically providers can earn lump sum incentives or higher reimbursement rates based off of their performance. And you get higher reward, but there's higher risk, of course. And it requires an organizational structure, so a larger structure. And many private practices are not in this pathway. You'd have to be pretty large. There are some private practices out there that do it, but if you're a small little 1-2 entity, no, you're going to be in MIPS, okay? So MIPS differs from commercial payer incentive programs in many different ways. So MIPS is actually run, it's a Medicare program. So it's run federally by CMS, where the other insurance incentive programs are run individually by that insurance company, UHC, Blue Cross, Aetna, etc. And then MIPS only applies to Medicare Part B providers unless you're exempt. And there are some exemptions for the program, and you can look that up. And the commercial incentive plans are only for providers that are contracted with those insurance plans, which makes sense. The measurements are standard nationwide for MIPS, and the measures that individual payer incentive programs are based off those individual payer measurements, okay? So Aetna is going to have different measurements than Blue Cross for the providers versus United Healthcare. And then it also can be even further specific to the plan that patients are participating in, like if it's a Medicare Advantage plan versus a commercial plan, something like that. The MIPS is a merit-based adjustment to their Medicare rates. So it's a long-term adjustment where the incentive plans by the commercial insurances is like a bonus or a penalty tied to their contract performance. So it's just for that insurance. It's not for all insurances, where MIPS is for all Medicare reimbursement rates, okay? The reporting for MIPS is it has to be reported annually. And the commercial payer incentive programs, there's a few different ways. I've had to do it myself, but payers can pull information from the claims themselves to see if you're hitting those benchmarks, or from your EMR if you have an integration or there's a way for you to upload things. HEDIS, CAHPS surveys, CAHPS surveys, something like that. Different insurances are going to have different requirements on how they obtain that information. So it's really important that you find that out if you want to participate. And the MIPS stuff is publicly available. It's very transparent. It's displayed on the website, etc. Where the private payers, the commercial payers, this is usually an internal thing. It's confidential. It's not put out there for patients and everyone else to see. Okay. So just some things to keep in mind. MIPS is mandatory, obviously, unless you qualify for a low volume threshold exemption. They do have those, and if you're not sure if you qualify for that, I would look it up. Where commercial incentive programs are usually optional, and they're tied to like the way you negotiate your contracts, quality initiatives, and then shared saving models, okay? So if you are like, oh, I didn't know insurances had incentive programs, yes, they do. Depending on your specialty, you would want to go find out on their website or give them a call to find out, okay? So a lot of people don't realize that there are incentive measures for the insurances. Like I know that I enrolled my providers a long time ago when this all started in a Blue Cross one, and I, as the office manager, was responsible for uploading all of the required information, but they got a really nice like bonus payment in like February of the following year for everything. And they really liked that. So, you know, if you're not aware of it or you're curious about it, definitely do your due diligence and do some research. So maybe you can start at January 1. Why this matters for practices? That's a great question. Well, MIPS performance is directly tied to your Medicare revenue. So, I mean, that's kind of a no-brainer. And poor MIPS reporting means that you have automatic penalties, which is never good because Medicare already, in my opinion, doesn't reimburse very high. And then if you're getting penalized, not good. If you have good performance, though, you get bonus opportunities, you have better public credentialing and reputation, and then you also have leverage in payer negotiations. So you could maybe say, well, I'm hitting my MIPS over here when you're negotiating maybe your Medicare Advantage plan contract with Blue Cross or something like that. Just keep that in mind. You have to understand your commercial incentive programs if they allow better contract management. Sometimes you'll get better reimbursement if you agree to be part of this. You can identify your bonus opportunities with this in your contracts or by calling them, and it can reduce denials versus performance improvement. So just some things to keep in mind. I do recommend that you find out if your EMR system helps you with MIPS reporting. A lot of them do nowadays, and take advantage of that. Be checking in to see where you're hitting your goals, your marks, if you're not hitting your goals, and where you need to improve, because right now we just hit November. So you have about 2 months-ish, probably about a month and a half if you take away all the holiday days off, but to maybe try to get those metrics up where they need to be before you have to report for 2025. If you want to know more about your commercial payers and those incentive programs, give them a call, look on their websites, look through your contracts, and decide if you want to participate, and then maybe implement starting the first of the year to really start tracking those things, ensure that your providers are documenting what's required, which is a huge kicker, and things like that. Okay, so anyway, be mindful of this. Check your metrics now. If you're already participating, you still have a few months before reporting, so fingers crossed you don't get any negatives and it's all positives. If you have any questions or comments about this, please leave that in the comments below. Smash the thumbs up button if today's video is helpful. Subscribe to my channel if you haven't already, and please share this with anyone whom you feel would benefit. I appreciate the support, and we will see you next time.